One health is usually defined by its scientific component, such as controlling disease in human, animal, and ecosystem. However, public trust is the one that boosts success in One Health interventions. Without it, the interdependence between human, animal, and environmental health collapses. The problem is the conflict between urgency and accuracy. When policymakers sacrifice transparency to control the messages, misinformation happens. This creates a critical gap between scientific solutions and public compliance, which delays actions and allows disease to spread, destroying human, animal, and environment. To bridge this gap, our study proposed two objectives: to define ethical responsibilities of policymakers and to identify strategy for transparency and scientific accuracy in One Health messaging. Our study is significant to understand policymakers' responsibility, identify strategy, and maintain public trust for public compliance.
Now let's come to the strategy. Our strategy focuses on establishing institutionalized cross-sectoral coordination and communication mechanism under the One Health approach. The core problem is that public trust is often eroded during health crises due to mixed message and fragmented responses. When human health, animal health, and environmental agencies communicate separately or not at all, the public perceive confusing inefficiency or even concealment. The GIC is a standing body that includes communication official, scientific advisor, and policy lead from health, agriculture, environment, and other relevant sectors. During a crisis, the GIC serves as a single authoritative source of public information, ensuring all messages are jointly reviewed, scientifically accurate, and consistent. By enabling faster response and preventing contradictory messaging, this strategy strengthens coordination and rebuild public trust by demonstrating unified government action.
One of the factors radical transparency is a must. In this context, it isn't just about sharing final result. It's about being open about the process by disclosing our data sources and acknowledging what we don't know yet. When the public sees the hows and whys behind a health recommendation, suspicion of hidden agendas is reduced and builds a foundation of long-term trust. Accuracy is the currency of public trust. Misinformation can lead to devastating health crises and economic consequences. By cross-referencing data between experts, before reaching the public, we prevent the spread of pseudoscience that often plagues the biotechnology advancement. Strategic urgency. In a health crisis, an information void is often filled by rumors if official channels are too slow. However, we must remember that speed must not come at the cost of accuracy.
Now, biotechnology is a double-edged sword. It brings numerous benefits for us. For example, in human health of medical breakthroughs, through the vaccines using biotechnology and also the environment where bioremediation through biotechnology were made successful. However, innovation without ethics is not progress. It is a recipe for irreversible systemic error, especially when ethics regarding information transparency to control messages for the sake of profits are ignored. Now, this brings us to One Health, an impact dashboard that features 4 distinct icons: health, where accurate data reduces transmission rates via public compliance; economic, where misinformation can cost millions, and through this One Health, it will prevent that; environmental, where it prevents knee-jerk wildlife culling through science-based messaging; and also community, where blaming specific communities or wildlife for disease will be prevented. One Health stands for policy responsibility, where transparency is a moral duty to prevent social stigma.
SDG 3 Good Health and Wellbeing, clear communication helps people understand health risks and follow prevention measures. This improves disease control and public safety. SDG 13 Climate Action shows how environmental change affects health. Honest messaging helps the public to see the links between climate change, disease spread, and environmental risks. SDG 15 Life on Land, ethical communication supports wildlife protection and better disease management. Healthy ecosystems reduce the risk of diseases spreading to humans. SDG 17, Partnership for the Goals, highlights the need for cooperation. One Health relies on strong collaboration between governments, scientists, and communities. In conclusion, ethical and accurate communication protects the environment, improves health outcomes, strengthens public trust, and reduces economic losses. Therefore, it is vital for long term public health resilience.